Hello everyone. In this video, we are going to talk about the inspection on five sense organs. The five sense organs refers to the eyes, ears, nose, mouth, and tongue. And also, because the observation in this session, when you observe the mouth and tongue, you also can see the teeth and throats. So then in this session, we actually talk about the inspection of the eyes, ears, nose, lips, teeth, and throat, as well as the gums. The first one we're going to talk about is the eyes. When we study the five elements theories, we have mentioned that there's one theory we're going to discuss in the diagnostics, the five wheels theories. So that's from the inspection of the eyes. The inspection of the eyes is very important, especially at the beginning of the inspection. We talk about the inspection of the spirit. How to inspect the spirits? We focus on the eyes. We try to see from the eyes. That is it. The color of the eyes, the luster of the eyes, the shape of the eyes, and the movement of the eyes can reflect the spirits of the whole body. This phenomenon also related based on the five wheels theories, because the five different organs, five internal organs, can reflect in the eyes. So the first one is the eye spirit. The eye spirit we're not going to mention here a lot. That's the same as the spirit's inspection at the beginning of the inspection. So as you can see from your textbook that regarding the colors, you also describe as the brown color, because the textbook is based on the Asian people as well. So here it depends on the races, like the whites or the colors. Even in the white, their eyes colors are different. So you need to consider the colors, especially from here. The irises, the color. So these are some of the different colors of the eyes. But this one is abnormal. We're going to show you why it's abnormal, especially from the sides. You can see the red, the veins there. So we're going to discuss what's the clinical indication of these kinds of sense signs. The five wheel theories is based on different area of the eyes. Firstly, we're going to see this image in the middle. What's the structure of the eye? Firstly is the pupil. The second is that's in the center. The second is the iris. That's the color side of the eyes, and also the white parts is the sclera, and also the eyelids on the upper side, and also the bottom. The canvas is in the corner of the eyes, so we base on these five areas. The pupil is known as the wheel of water, that's associated with kidney. The iris is the wheel of the wind, so the color is linked to the liver. The inner and outer canopy is the wheel of the blood and linked to the heart. The sclerus is the white part of the eyes and considered as the wheel of qi. The spleen is the wheel of flesh. So based on these theories, when we observe the eyes, if there's some abnormal from the eyes, or different parts of the eyes, it can indicate the abnormal situation of the internal organs. For instance, the size of the pupil, the color of the scleras, The color of the sclera normally is white. If it presents as yellow, it's a typical sign of jaundice. If it presents as the redness, such as the one in the previous video, the previous slides, white from the white parts in the previous slides, in the white parts of the patient causes the redness in the corner. That can indicate the sclera is the area of the lung. The redness is the color of the fire. So in that situation, we can indicate that the lung heat. The patient also may present with cough if it affects the lung, but it also may only affect the eyes. That's how we use the 5-wheel theory to treat clinical diseases. Changes in eye colors and lusters. This is a picture taken from your textbooks. You need to be careful that there's one mistake. The yellow iris, it should be the yellow sclera. So all the iris here in this table should be sclera. Why the redness, swelling, and pain is the excess heat. That's because the heat, the fire can increase, can go to the top part of the body and also can increase the circulation. It depends on which area the heat is, the redness. If it's in the corner, that's the hot fire. It's in the sclera, it's just the lung fire. And if you see in the eyelid, how do you see in the eyelid? You can just pull your eyelid slightly downwards. You can see the inside of the eyelid. That can indicate the spleen. The pale or the white can fit the blood deficiency of loss of blood. This you also can see from the inner parts of the eyelid. So these are some of the abnormal changes. We are going to show you some images. So the first one on the left side, you can see the yellow, in the yellow color, also the skin, although you can't see properly the skin. It looks yellow, but you also can see from the lights. It might be from the lights, but this is a jaundice patient. This is a very typical sign of jaundice, of the yellow scleras and yellow skin. And how Chinese medicine and acupuncture theories understand the jaundice. That's due to the dampness or damp heat in the liver or the spleen will cause the yellow color in the eyes and as well as the skin. Also from the picture on the right side, you see this eyes. In the scleras, you see the redness here. So the scleras is the area of the lung. So that's the heat. That's the redness. The redness is the heat. So when you use the knowledge in the facial complexion, it says that the redness can indicate the heat, right? So that's the sentence that I asked you to remember. At least there's a lot of descriptions if you don't remember, but at least the description of the color, the first sentence of the text from the textbook from different colors. The first you need to remember that a red color often indicates heat or yang floating syndrome. So when you see a patient with a red color, you need to think about the heat. It can be excess heat or deficiency heat. But it's in the category of heat. So here is the heat, is the lung heat that presents in the sclera, but also when you see from the eyelid, the inner part of eyelid also red. So that also can indicate the heat in the spleen. So this patient may have both spleen and lung heat. So in the treatment, we're going to focus on these two. So these are some other abnormal changes of the eye shape. You can go through the description by yourself. We're going to show you some images. The abnormal change in eye shape is seen in the eyelid. This patient, she could not lift up the left side of the eye, the eyelid. So in this, if a patient presents with this, how should we treat this problem? The eyelid is related to the spleen, so we actually going to focus on to recover or restore the spleen function. Then it can help to move the eyelid. But also because of the eyelid is the muscle also related to the spleen. So that's why we're going to focus on the spleen for this kind of problem. This is the inflammation, infection here. That's also the patient can present with heat, with pain, with redness in this area. So that's also the heat because it's in eyelid. So that's the heat in the spleen. Goiter patient can present with the protruding of the eyes. So you can see the eye is bigger than normal. This is the protruding when you see this kind of patient. When you see a patient, the patient's eyes presents like protruding, you need to think about ask them to go to the lab to check the TSH, the thyroid function. The last image, you see this patient, the eyelids could not open, and also you see the the eyes, especially when you see the irises. You know, last there, this is this patient. It actually was taken. The picture was taken in a final stage of just the patient before death. So this patient is dying. That's the the signs of the severe condition. So when you see a patient present like this, you need to be careful. This is not a good sign. So from the inspection of the eyes, we can see a lot of clinical information. Apart from the colors of the pupil of the eyes and the shape of the eyes, we're also going to focus on the the pupils. The observation of the pupils mainly focus on the diameter of the pupils. So to the dilated pupils and constricted pupil. In order to distinguish these two, we need to study about the normal size of the pupil. The normal diameter of the pupil is about 3 to 4 millimeter. So above 3 millimeter, especially above 4 millimeter, it is considered as dilated. If less smaller than 3, it's considered as constricted pupil. The dilated pupils mostly happens in severe condition, especially when people before death. So this is a very important sign of the death. And also sometimes in some conditions, some poisoning also can result in dilated pupils. The constricted pupil. The constricted pupil mostly happens in some poisonings, especially for some chemical poisonings. The last one is cataracts. Cataracts is the disease that especially happens in the senior patient. So this is, you can see the pupil looks, it also looks, the diameter also looks bigger, but this is not considered as the severe condition. But this is the severe condition of cataracts, but not severe condition of the life. It's not a life-threatening disease. So these are some of the common abnormal eyes. The change of the eyeball's movements. So the eyeball movements, such as the reflection towards the light, the pupil will change the shape, as you can see from this image. When the eye opens, you can see the pupil becomes smaller. You've seen there, becomes smaller. So that's the normal reflection of the eyes. So these you will study more in your diagnostics in the general medicine. So from this session, what you need to understand is how we use the five-wheel theory to analyze these clinical symptoms and signs. The next one, observation of the ear. The ear is the orifice. So for the observation of the ear, we focus on the shape of the ear, such as the shape, the color. So as you can see from beginning until now, when we talk about inspection, we always focus on the inspection of the color, the shape, the luster, and some abnormal changes. So when you talk about the head, you're going to focus on the color, the shape, the luster. When you talk about the eyes, we're also going to see a few aspects from the ear as well, the same. So such as this ear is you can see it's from a senior patient. It's dry and thin ear. So this kind of ear can reflect the kidney deficiency. Also, the color of the ear, see on the side is darker. So that also can indicate the kidney problem. The changes in the ear, you see all these colors. Why I asked you to remember the colors in the facial complexion. That's because those colors, those indications, you can use in all kinds of diagnostics. That's why they are very important. Whenever you see redness in some areas, you can think about the heat. It can be the excess heat. It also can be the deficiency heat by which they cause yang bloating syndrome or hyperactive yang. Whenever you see pale, you can think about the deficiency, the loss of blood syndrome. So as you can see here, the pale white deficiency of qi and blood. So pale indicates deficiency. Whenever you see these colors, red mean the fire, mineral fire. Do you still remember in your test what's the mineral fire? That's the kidney yang. So the red is the fire. So the indications is from the facial complexion from page 20 to 22 of your textbooks. You can see the indication, the first sentence on below the color. The change of the shape is in the previous image. The change of from this image, you can see some pus in the ear. That's the inflammation of the ear. So how do we understand in acupuncture theories? It depends on the other symptoms as well as the property of the pus. If the clear pus is due to the coldness, if a thick and yellow pus is due to heat. So even the pus, we're going to distinguish with different signs. Changes in the auditory meatus. So the previous image is supposed to be in this slide. That's the abnormal damp heat. It can be damp heat, can be damp coldness. It also can be the deficiency. All depends on different symptoms and signs. Observation of the nose. We're also going to focus on the colors and lusters. So the bluish tip, blue is the cold and pain, yellow damp heat, red heat. It can be summer heat or blood heat. So at least when you see the colors, you're going to reflect you. Whenever you see the red discussion, you need to reflect to heat. And then which heat you can see from the other signs and symptoms or for inquiries. So these are different colors. Change of the shape. Change of the shape. So this one is the change of the color, the redness. The redness is the heat, so it can reflect in the stomach heat. And also from here, you can combine with the theories from the facial complexion, from the location of different area of the face. We have shown you in the previous videos that the different area of the face can represent different area of the internal organs. Why? For this redness tip, nose tip, you think about the spleen or the stomach heat. That's because at the tip of the nose, it indicates as the spleen. This you can go to the previous lecture notes or from your textbooks, page 19. You can find the figure 1-2. You can see that this area is the area of the spleen. So the left image, this one also not easy to see. It's not common now. Leprosy. This is the very typical sign of the nose. It's the abnormal changes of the nasal passages. Observation of the lips. The lips, when you observe the when you observe the mouth, you can see the lips, the teeth, the gum, and also the folds. So from the lips, when you see the lips, you need to consider the races. So from here, for the colors, we will speak faster and you just need to go through them by yourself. The pale deficiency. What kind of deficiency? It can be blood deficiency or qi deficiency. The red heat. It can be excess heat or deficiency heat. The dry is the dryness, the heat consuming the body fluids. The dark purple, stagnant blood. You see all these descriptions. That's the That's according to the characteristics of the different colors in the basic theories, according to the characteristics of different etiologies, the pathological factors we have discussed in the basic theories. So for these information, we're not going to explain in detail now. Until now, you should, whenever you see the pale, pale white or pale, you should reflect deficiency. Okay, so for this contents, you can go through by yourself. If you're still confused, you can contact me. From the lectures, we're going to focus on some images to show you how to observe. The first one is pale lips. The pale lips. The second one is cyan or bluish. You see here the dark color. Black lips. But when you observe this kind of color, you also need to consider the race. So from this two, I also give you two images. And that's these two images. These two, the lips, you can't say this is pale for this patient because this is a white lady. This is a black lady. You can't say this is black is abnormal. This black color of the lips is normal for her. So when you observe these kinds of lips, the color of the lips, you need to consider the race, the races as well. When you observe the lips, you also can see inside there. There's kind of ulcer there. This is related to the spleen. The changes in the movements, deviation of the movements. So this is the deviation of the face we have discussed. That's due to the wind. Twisting of the mouth to one corner, also the wind. Trembling. Trembling is also the same as the trembling of the body. The trembling can happen in the face. Trembling is a kind of moving. That's also the wind. But what caused the wind? You can go back to the five internal evils. What can cause the internal wind? That's how you're going to treat this kind of trembling. The observation of the teeth and gums, the color also still the same. The teeth is the extension of the kidney, the extension of the bones, which is related to the kidney. So the teeth health can reflect the kidney's health. The gum, the colors still the same, different gums. I'm going to show you some images. The first one, the teeth, you can see the roots of the teeth here, this area. So this can indicate why you can see the roots of the teeth. That's because the gums problem. The gums related to the muscle, related to the spleen and kidney. This one is the swollen gum. It's also, the swollen depends on the color and the patient's symptoms. It can be the heat. This one is the dark color and dark color or kind of bleeding that can be extremely heat. This can be the stagnant blood. So from the observation of the gums, you can see different situations. The thoughts. The observation of the thoughts. If it depends on which area of the thoughts and according to the meridian, at the back of the throat, the kidney meridian goes at the back of the throat. So if a patient presents with a throat problem at the back, it might relate to the kidney. If the throat is affecting on the side of the throat, it can reflect the stomach and spleen. Changes of the colors are still the same, so you can just go through by yourself. We're going to show you some images. From this throat, we want to show you the tonsils. The tonsils is enlarged. So this is the when you observe the throat. The first thing you're going to see is the tonsil, and then at the back of the throat. The color of here, when you see these three pictures, you can see they got different colors. This one is pale compared with this. This is red. What's the reason for these two, the difference? Or even this one is pale. That's because this inflammation, this enlarged tonsil is due to heat. This enlarged tonsil is not due to heat. And also you can see from the color of the tonsil, this one is red, this one is pale. So in the treatment of these two kinds of enlargements, we also have different treatments towards them because the causes of these two are different. This one, the first one, we're going to clear the heat. This one, we might going to tonify the spleen. From this slide, we give you some of the images of the different grades of the enlargements of tonsil. So they got 5 grades. This one is normal. You can see from here, that's the enlargement of this. And that's in clinic, you can see the enlargements and there's some inflammation there. So for this kind of, when you see this kind of problem, you can think about what's the color of the throat, what's the color of the mouth and the tongue. Because when you see the throat, you can see all of them at the same time, the tongue, the throat, the color of the tonsil, the color of these areas, pale or red can indicate different situation. And when there's some pus, the white part, when you see some pus there, you can see some inflammation. This inflammation, the pus, is the result of fire damaging the muscle. So that's can be the heat. It also can be deficiency because the muscle don't have enough nourishment. So that's the observation for the thoughts. The pus and ulcer. When you see from these two images, the one on the left side, you can see these two patients have the ulcers in the close to the throat, and what you can see that what the difference is around the ulcer, this area and this area. The top one is red compared with the bottom one. The bottom one is pale. So these two of appearance, you need to think about the causes. When you see the redness, you still remember the redness, that's the heat, the fire, right? So compared with these two, the top one is due to the fire, the bottom one is due to the deficiency. That's why it's cold. That's why it's pale. But for the fire, you're also going to distinguish, is it an excess fire or deficiency fire? So that's something you can You can some information you can get from the other symptoms or signs. When you see the redness, the first thing you're going to reflect in your mind that it is a fire, and then from this fire, is it an excess fire or deficiency fire? So from now, from this ways of thinking, we realize that if you remember the basic theories, you actually already apply the yin and yang theories in this thinking. When you see the redness, you think about the fire. So that's A equals B, B equals C, right? A is C. That's when you see the redness, redness reflects the fire. Then when you see the spatial, you can think about the the fire. And then in the category of fire, you're also going to distinguish with excess fire and deficiency fire. So that's yin and yang. Within yin and yang, you also have yin and yang in yin and yang. That's the theories. So when you compare with these two, the top one is yang because it's red. The bottom one is pale. So this one is yang, the bottom one is yin. But in the yang ulcer, you're also going to have yin and yang in this side. One is from deficiency, one is from excess. So this kind of thinking, that's the theories we learn from yin and yang theories. You see, if you remember these theories, you actually apply these theories like automatically. You don't really realize that you using these theories, but that's how we understand the clinical situation. Because even from the same ulcer, like this, the redness there, with excess out fire and the deficiency fire, we use different kind of treatments. That's why it says a pale surroundings indicates deficiency syndrome, and then it should be a large ulcer or depressed ulcer sign of exogenous heat, exuberant heat, excess heat. So that's something you need to, when you see the redness, that's something you need to distinguish. So all above is the information that we need to know about the inspection on the five sense organs. As you can see, until now we have introduced the inspection on the face, the inspection of five sense organs. As you can see, some of the information is quite specifically. So it is actually the knowledge in different specialties, such as the teeth and the gums. That's the specialty of the dentist. So from Chinese medicine or from acupuncture theories, from our diagnostics, what's important here is you're going to have a general understanding, you have a general impressions on these clinical phenomena, which one is normal, which one is abnormal, and what's most important in this video is the five wheel theory from the eyes. So you need to remember the five wheel theory because from the basic theories we have given you the general introduction of the orifice of different organs, such as the eyes are the orifice of the liver, but more specifically, the eyes also related to internal organs. How to distinguish the internal organs from the eyes? That's from the five wheels theory. Also from the name of the five wheel theories, such as which one is the wind wheel, which one is the wheel of blood. So you need to remember this. From this inspection, especially from the five senses organs. As you can see, some images we show you, and also I have told you that some of these conditions is not common now because some are very rare diseases. So from this inspection, most important is in the inspection of the eyes, especially from the five wheels theory. The second is we need to the inspection of the throat. The inspection from the mouth. We're also going to study the tongue diagnosis in future, which is focused on the tongue. That's also from the mouth. So the inspection from the mouth, from the throat, and the tonsils. So that's most important in this video. Thank you for your attention.